COVID-19 on employees' working lives. I'm Ed Houghton, and those of you who are regular viewers will recognize that I am not Katie Jacobs, who is the regular host of our CIPD coronavirus webinar series. Katie is taking a well-earned break and has entrusted me with the pleasure of running today's webinar session. It's great to be joining you today. We've got a really great lineup of speakers to talk about this really important issue, which is understanding and measuring well-being through the coronavirus pandemic. So today we've got two speakers who are going to walk us through some of the latest evidence and insights into how the current COVID-19 pandemic is affecting the working lives of UK workers. And our experts are going to share some of their data and insights from across their areas of work. And then what we're going to do is then move into a discussion, a Q&A, so you can ask some of your questions through the Q&A function on this platform to our panelists to explore some of the issues that you might be seeing in your organizations when it comes to understanding well-being through the coronavirus outbreak. So I'll just do a quick introduction to our speakers today. So first up, you'll be hearing from Mel Green. Mel is a research advisor at the CIPD. She's an expert on evidence assessment, and she leads the CIPD's COVID-19 employee survey, which is our survey of 1,000 UK workers that we're running over the next 6 months to explore the impact of coronavirus on UK workers. And she's a published expert who looks at evidence around inclusion practices and ethical decision-making. And Mel is a trained occupational and organizational psychologist. And joining Mel and myself is Deborah Hardoon. Deborah is Head of Evidence and Analysis at the What Works Wellbeing Centre, which is an independent collaboration centre that develops and shares robust and accessible wellbeing evidence to improve decision-making by businesses, governments, and also civil societies. So Deborah is an expert who's worked across areas and organisations including Oxfam. She was previously a research manager at Transparency International, and she was responsible for something called the Corruption Perceptions Index. So Deborah is an expert when it comes to understanding and measuring important issues in the world of work today. So before we start, I just want to run through some housekeeping notes for all of you who are joining us today. So this session is being recorded and it will be available to download. You can download all of these webinars that we've run on the CIPD website. You can also look at some of the upcoming webinars that we're going to be publishing. So coming up later this week on Friday the 29th is our Diversity and Inclusion through COVID-19 webinar. So make sure you sign up on the website, and you can also check out lots of other content via the Coronavirus Web Hub. Through this conversation today, obviously we want it to be participatory, so please do ask any questions that you might have through the Q&A function on Zoom. All of you will be muted, so any questions must be submitted via typing. The session today is going to look really closely at data and research. So if you are looking for practical guidance and support, we do update our coronavirus FAQs on a regular basis. We also have new content that's updated onto the website through the Coronavirus Hub. So please do check there if you have any practical issues that you might be facing. And if you have any questions that in particular require legal advice, CIPD members can call our HR Inform helpline, which is available 24/7. And there you'll get an individual response according to your inquiry. So do check out those resources if you're looking for some advice or information. Today, obviously, this is the section that we're going to be running, which is looking at wellbeing. So first, I'd like to really also flag that we have a new wellbeing hub and helpline that has been developed for members who are in the UK and Ireland. So together with an award-winning workplace provider, Health Assured, we've now put together for CIPD members a free helpline, and we support 24/7, 365 days a year via telephone and online consultation. And through that, you can access qualified therapists. So members can access the phone number and the online services via the membership benefits webpage. And you'll also see there's a lot more details that we'll share about that at the end of today's session. So now we can move on to the conversation today, which is something I know many of us will be thinking a lot about through this current pandemic, both for ourselves, for our workforce, our employees, for our families, for our friends. Wellbeing is particularly challenged in this current context, an incredibly important concept for us to be considering. But clearly the current context is unprecedented, which is no doubt going to be the word of the year to describe this crisis. And many organizations that you are working in your workplaces will have changed radically, some of them overnight. And many of the workers and employees that we work with on a daily basis will have experienced significant disruption to their regular working patterns, and that will impact not just their home life, but also their work life as well, and relationships that they may have at work. Many may be furloughed, many working from home, many may actually be continuing through their regular working patterns, but just under very different conditions. So it's really important that throughout this crisis, we try to understand and measure the impact of coronavirus on aspects of job quality for individuals. And a really important part of job quality that we understand at the CIPD is individuals' well-being. So individual well-being is a key part of how we understand job quality in the wider world of work. And through understanding well-being, we can look at different aspects of individuals' job quality. We can measure well-being to tell us a deeper understanding of how individuals experience the workplace. And given that this is a highly disruptive time for individuals, it's very important, therefore, that we think about how we measure and understand individual level well-being. And that obviously could have an impact on aspects of broader job quality, and over the long term may have an impact on wider productivity for individuals, organisations, and wider society. So today's webinar is going to look at the evidence around the current state of well-being for UK workers in organisations today. And the conversation today is going to explore some of the research and evidence that's telling us the current state of well-being for individual workers. And we're then going to talk a little bit more about some of the challenges that individuals in organisations may be facing. And in particular, for those of us who may be working at home, some of the very unique challenges that may come up for those working at home and how that could interact or impact on their well-being. So first up, I'm going to hand over to Mel Green. Mel Green, she'll talk through some of the presentation around the CIPD's data that we've just recently conducted a new survey. So we've got new data that we can share with you today. And she'll share some of the perspectives from that data set before we then move on to Deborah, who will share her perspective from the What Works Centre. So first up, I'll hand over to you, Mel, if you want to unmute and take us through the presentation.
Thanks, Ed, and hopefully everyone can hear me okay. Thanks for that introduction, and thanks to everyone for joining today. Great to see so many of you here after the bank holiday weekend, so thanks for joining. So Ed's already introduced me, so I won't say too much about myself. I'm Mel Green. I work in the research team at the CIPD, and one of the things that I'm leading on at the moment is understanding the impacts of COVID-19 on UK employees' working lives. So a really important topic, so pleased to be sharing some of our first initial findings from this survey today. Next slide, please. So I'll tell you a little bit about the research and the context of that before I jump into some of the findings. So as you might imagine, job quality and good work is something that we passionately promote at the CIPD, and it's something that's completely aligned with our core purpose, which is to champion better work and working lives. So we've been looking at job quality and good work for a number of years, both in terms of our research and our content. And a key part of that is our UK Working Lives survey, which informs our Good Work Index. Now that's something that we have published since 2018, and we're actually publishing the 2020 January data next week. And that's all about UK job quality. What do employees and workers feel about their working lives? So we know that it's really important that people have employment, but it's also really important that the quality of that employment is good. So whether they have a secure job, whether they have good pay and benefits, whether they have access to other things like good opportunities for voice, and whether work impacts their well-being. As Ed's already mentioned, this is a really key part of that job quality. Do people feel a positive impact of work on their well-being? And in general, what's their well-being like? We know that's absolutely core in terms of job quality. So what this new survey is all about is about building on that, because we recognise that things are rapidly changing at the moment. I think that's perhaps an understatement, that how we experience our jobs at the moment is very different. We are facing a number of different challenges, whether that's people being furloughed and being uncertain about their role, whether people are going into work, what's that like for them? And also, what's this experience like for people that are still working remotely or at home? For some, that might be a really positive thing. For others, that might be a little bit more challenging. So what we're really doing with this survey is tracking core parts of working life, as well as looking at some focus questions that specifically relate to COVID-19. So that could be well-being, it could be financial security, it could be perceptions of their employer's response to the pandemic. So a really broad survey, and as I'd already mentioned, we'll be doing this on a monthly basis over the coming months. It's a survey of 1,000 UK workers that's conducted via a YouGov panel, which gives us a really robust picture of what's happening. And the data that I'll talk about today was collected at the end of April, and going forward, we'll be doing this on a monthly basis. So on to the findings. Next slide, please. So I'll talk a little bit about how wellbeing's been impacted by COVID-19, and also related to that is how employees feel about returning to work, because following government announcements, we know that more and more employers are starting to plan or have a phased return back to work, and it's really important that we understand how employees feel about that. Obviously, that has a number of implications for their well-being, both in terms of physical and mental. So I'll talk a little bit about some of our early findings there as well. Great, next slide, please. So before I talk about the well-being portion of this, I thought it would be useful to give you an insight into who we talk to in this survey and what their working arrangements are like at the moment. So of the 1,000 that we surveyed, 21% of respondents were furloughed. So a small minority of people are furloughed. Interestingly though, we also asked whether people knew whether their furlough would end, and actually half of people on furlough didn't know when that furlough would come to an end. Perhaps unsurprising given the uncertainty, but it's really important to note this because obviously for this group of people there's a lot of potential uncertainty that could impact their well-being at the moment. It's clearly a very uncertain time both for businesses and the people that are working in them or are furloughed. So for those that are working, we've got a 60-40 split or thereabout in the survey in terms of people that are going into work as normal, so whether that's in a retail, healthcare setting, anything else. But actually 61% working remotely all the time. So we've got quite a split here, and of course it's important to note that the experience and the potential wellbeing impacts here might be different for someone that's going into a normal workplace compared to someone that's working at home as well. So in this, it's really important that we think about both of those groups too. Next slide, please. So let's talk a little bit about the impact on wellbeing. So in general, what we found is that there's a mixed picture here. So we talk about both mental health and physical health. Obviously, it's really important that we distinguish between the two. And on the positive side of things, around half of people have said, actually, my mental health has stayed the same or my physical health has stayed the same. So that's quite positive. However, what we also see is a significant minority of people saying both their general mental health has got worse, as has their general physical health. So obviously there's a lot of reasons why this might be. It's not necessarily just related to work, but it's really important to note that many workers and employees are feeling that there are various impacts on both their physical and their mental well-being here. Something really important to consider when we think about why that might be the case. So it could be, for example, that people with existing mental health issues are finding this particularly challenging. So if you already have anxiety or issues with that, especially if they're related to things like health, that can be this is a potentially really difficult time for people. And this is suggested by our data as well. So we ask people within this survey whether they have existing underlying health conditions. And what we found was that the people that do have existing mental health conditions, they are very much more likely to say that this has got worse since the onset of the pandemic, or they feel that the pandemic has contributed or worsened it. So really important here that when we're thinking about employee well-being, it's about, of course, an overall impact of pandemic. A lot of people are struggling, but that's particularly difficult for people that might have existing underlying health conditions. And of course, this can be exacerbated by other things that come out of the pandemic. So, for example, struggling with things like increased social isolation when people are working from home, people's usual support networks at work might not be there, or perhaps if people are working as normal, their working environment is going to be very different in some cases, even if they are going into work. So really important to think about how individuals have a different reaction to this. We see a similar story with physical health. So not quite as pronounced in terms of worsening of physical health and mental health, but nevertheless, there still seems to be a similar trend. So around half of people saying their physical health has stayed the same, but 35% saying that actually their general physical health has got worse since the pandemic. And again, similarly, when people have told us that they have an existing condition, they are also more likely to say this is worsened. So to give a specific example here, 25% of those with backache or muscle problems have said this has got worse since the onset of the pandemic. So a really important point here around things like how people are working. So let's say people are working from home and they have existing conditions, so back problems. Thinking about how the workplace or their home workplace is set up is going to be really important to make sure these numbers go down. Next slide, please. So I wanted to take a pause there and really hear from you and get your reflections on whether this resonates. So we've got a poll here, which should be setting up shortly, and would like to hear whether this resonates with you and how you see wellbeing being impacted in your organisation. So there are a couple of options that wellbeing has got better, because of course, in some cases, this might ring true. So for example, if people are commuting less, they might feel that actually that's an additional time they've got back and that's contributing to their well-being. Have you seen that well-being has worsened in your context? So in organisation or organisations you work with, do you think actually on balance it stayed the same? Are you not sure? Or if it's something else entirely, tell us, and please tell us more in the chat. So just waiting for some of those results to come in. Great. So I'm having just a look at the results here. So it looks like, again, quite a mixed picture here, which is very much aligned with our results that suggests that it's a very mixed bag. It very much depends on individual circumstances and context here. So it looks like on balance, more people have said that wellbeing has worsened. So 36% of you saying that you've seen wellbeing worsen in your organisation. Interestingly, 13% say it's got better. So a comment here saying people actually might have a better work-life balance working from home, but also there might be some potential isolation issues to contend with. Around 24% say it stayed the same. So around a quarter of you saying that. Others saying not sure. So 21% saying you're not sure about how well-being has been impacted, which will be something interesting to discuss as we go through this when we're thinking about how we measure the impact of well-being and how we can tackle that. I'm just looking through the comments here. Yeah, again, so others saying that there is, again, a mixed impact and perhaps some trade-offs here. So some potential improvements from travel time, but struggling with things like isolation too. So thanks for all your comments. It's really interesting to hear some of your reflections. And we'll move on now to the next portion of our findings. So another thing that I thought it was really important for us to talk about here is returning to work. So talked a little bit about potential anxiety that people might be feeling in general because of the pandemic. It's also really important as we move towards returning to work where it's essential and safe to do so, that we ask employees about how they're feeling, because of course there's potential mental and physical impacts on well-being here when we start going back into the workplace. So a key thing we really wanted to understand here is how people feel about coming back to work. And this is all people that are working from home or remotely currently, so people who aren't in their workplace. And so a clear picture here that people are, in some cases, fairly concerned about returning to work. So we found that 4 in 10 feel anxious about returning to the workplace. So a fairly significant number here that are potentially concerned for various reasons about returning to work. And importantly as well, of course, we've got to think about how people get to work, because it's not only the workplace that employers need to think about or employees might be concerned about. There's obviously the commute to think about as well. So we also asked people how they felt about commuting, and this was slightly lower, with 3 in 10 saying they were anxious about commuting to work. But a really important caveat here that this rose to around half of people working in London. So presumably that's because people in this area are far more likely to be commuting to work on quite busy public transport systems. And this is understandably a worry when people are thinking about their potential safety on those public transport systems. So it's not just that workplace that employers need to be thinking about in terms of, is it safe, and consulting with employees. It's also thinking about how they might help support in terms of being safe on the way to work as well. So really important things there. So we talked a bit about well-being up front, and about how there is a need to think about people's individual circumstances, perhaps their individual underlying health conditions, any other issues they might be facing, and really taking an inclusive approach when we're thinking about well-being. And this is also true when it comes to returning to the workplace. So some people might understandably be concerned than others about returning to their workplace. And this is something that we've definitely seen in our survey results. So as part of the survey, we asked people whether they are self-isolating or shielding because of an underlying health condition, and similarly, whether someone in their household was doing this. So a small minority of people in our survey said they were, but it's really clear that from those groups, people are far more anxious about returning to the workplace, as you might expect. So 6 in 10, compared to 4 in 10 generally, said that they were anxious about returning to the workplace if they had an underlying health condition. Obviously, there's potential higher risk there for this group. So when we're thinking about returning to work, that's something that ultimately needs to be addressed. Similarly, on the commuting side of things, we find that people that have underlying health conditions, as you might expect, are concerned about commuting. But of course, it's not just about the individual. It's about their situation and their family too. So we found that people who have a vulnerable family member are far more anxious about commuting to the workplace when they return to work too. So it's not just about thinking about the individual, but understanding their circumstances as well. Another point to make here is that it's not just about health conditions, of course. We know that people are struggling with childcare at the moment, and that's a key concern, really. And that's true when it comes to return to work. So we also found that half of people with increased care responsibilities are anxious about returning to the workplace. So again, something that employers and people professionals will really need to think about is, if someone does have caring responsibilities and childcare hasn't gone back to how it was pre-pandemic, how will they manage that, and how will they ensure that people are safe when they come back to work? Great. So thinking about, to sum up on this, I think it's really clear that there's a general trend that there's a mixed bag when it comes to wellbeing. Some people feel less affected than others, but in general, we are seeing a significant amount of people saying that their wellbeing has been impacted, as you might expect. But what this really demonstrates is that when we're thinking about wellbeing, whether that's measuring or supporting people, it's really key that employers and line managers understand the individual circumstances. So that might be their individual wellbeing concerns or their situation at home. I think now more than ever, we've really seen a light shone on how people's work and non-work boundaries have been blurred. So thinking about how we can support employees through this by thinking about their circumstances is really important. And I know that's something that Deborah is going to talk about in a little bit more detail, about some of the factors that we might need to consider when we're thinking about being inclusive with wellbeing. So with that, I will hand back over to Ed and hand over to Deborah too.
Thank you very much, Mel. Really insightful set of data there about the way that we're seeing COVID-19 having an impact on individual levels of well-being. And really interesting to hear some of your reflections as well on the panel discussion, on the panel element of the Q&A. So there are a couple of questions coming in and your answers as well to the poll, very useful to see that there's been some clear benefits to individuals as well as some clear negative points that we need to reflect on. So great to have you participating in this webinar today. So next up, we'll hand over to Deborah, who's going to talk about the What Works Wellbeing Centre's perspective on the current status of evidence and data about the COVID-19 pandemic's impact on wellbeing. So Deborah will give us a bit of a background on some of the really interesting work that she's been doing with experts at the centre, working with policy advisors and central government, as well as looking at what's happening across employers. So over to you, Deborah.
Thanks, Ed, and thanks for the introduction and for the invitation to join you on this webinar today. I think I'll jump straight in by giving a brief description of how we at the centre talk about wellbeing. So next slide, please. So wellbeing is how we're doing as individuals, communities now and in the future, and it encompasses all the things in life that are important to us. So we talk about well-being as the ultimate goal. It's a very broad and holistic goal. It's what we as individuals strive to achieve in our life, what communities are looking for, what countries are looking for, and what organisations and employers are looking for in terms of success and progress. So it encompasses all the things that happen to us, all of our experiences, all those external factors. It includes our health, our income, our job status, but it also includes things that are intrinsic to how we feel about ourselves as individuals. So our self-confidence, our self-efficacy, our sense that life is worthwhile. So there are all those external drivers as well as those internal drivers that affect our well-being. But also it's important to mention that well-being isn't just about us as individuals. Well-being as a society, well-being as a collective is about our shared connections, our shared resources, and our shared future. So that's how we think about well-being as being really important and ultimately as the goal for individuals, for organisations and for society. We know that also people with a higher level of well-being are more creative, more productive, and more and really contribute to sustainable organisations that are really successful as well. Next slide, please. In the UK, we've been measuring well-being on a number of dimensions systematically since 2011, and those measures include 4 questions that are included in the annual population survey, which ask people directly how they're doing. So it's a deliberate way to subjectively ask people how they feel about their lives, putting people in control and saying that people are the best judge of how things are going for them. So the 4 subjective questions that are asked in the UK are: how do you feel about your life overall, your life satisfaction? How happy did you feel yesterday? How worthwhile do you feel your life is? And how anxious do you feel were you yesterday? So we capture those 4 different dimensions of personal subjective well-being every year for the last 8 years. What we've seen is in the UK a slow but important increase in life satisfaction, happiness and sense of worthwhile, and a decline in the levels of anxiety in the UK. But these questions are quite sticky, they're quite slow to budge. So actually the axes on these charts shows that the change is actually quite small when you expand it to a scale of, the question is asked on a scale of 0 to 10. So these measures are steadily, on average, have been increasing in the last 8 years since we've been collecting the data. Next slide, please. But of course, that's the average. And we know that averages hide a lot of variability between different people in the country. And actually, people that are reporting very low levels of well-being, people that are really struggling with anxiety, with a lack of worthwhile, that are unhappy, these are people that are more likely to be experiencing bad health and be economically inactive, be middle-aged. Actually, people that are younger or much older tend to be more satisfied with life on their own, be single, separated, widowed or divorced, be renters and have no or basic education. So these are just some of the factors that we know will influence the likelihood of somebody expressing a low level of well-being. The diagram on the left-hand side of this slide also maps the Sustainable Development Goals against evidence of the determinants of mental disorders. So this just brings into clarity the fact that there are all these diverse influences of our well-being at the national and international level, as well as at the very personal and individual level that we must pay attention to. So it's a very broad area that we're looking at here in terms of what matters to people at the individual and at the collective level. Next slide, please. So what's happened in response to the COVID pandemic and its response? Well, the ONS have been collecting data more recently with a smaller sample than their annual population survey, but also asking these important 4 well-being questions. And what we've seen on life satisfaction is that trend of a steady increase in life satisfaction has reversed, and we've started to see a decline in the average level of life satisfaction that people are reporting, but also that the proportion of people that are reporting a very low score in life satisfaction, so that's reporting that their life satisfaction is between 0 and 4 on a 10-point scale, has increased to over 10% of the national population. Next slide, please. On anxiety, we've got a similar trend. So since the data has been collected after lockdowns, those last 3 bars with lockdown kicking in about the 23rd of March, and average anxiety levels, which is the yellow line there, has increased, and the proportion of people reporting high levels of anxiety, so that's the red bars, has also increased. What we've interestingly been seen though is over the more recent weeks, so actually the data that's come out since the 13th of April, so since that last bar, is anxiety levels have started to decline again. So the most recent data from last week showed that the proportion of people in the UK reporting high anxiety has gone back down to 32% from the high of almost 50% immediately following the lockdown. So what is important to consider here is that the effect of a change, any kind of change, can be really destabilizing for people, can affect people's happiness and anxiety. And there can often be, in response to many changes, an adaptation effect as people get used to the new status quo. And we see that in other life events that happen to people. We see, for example, the shock of being widowed. There's a very steep decline in life satisfaction immediately following being widowed, but the people gradually adapt to their new life and life satisfaction recovers somewhat after that. Similarly to marriage, we see a spike in life satisfaction immediately preceding and after marriage, but that falls back down to the level that they were at in a partnered relationship before that. So we're starting to see some of this adaptation as people get used to the new normal, but it's also a flag to say that more shocks and more changes can very quickly increase anxiety levels for people, and that it's change itself that can be the stimulant of anxiety as opposed to the actual underlying change that's occurring. Next slide, please. What we've also seen from this more recent wellbeing data is that it's reflecting differences between different groups that we see in the data anyway over the course of the last 8 years that we've been analysing this data. That, for example, women tend to be more anxious than men. People with disabilities tend to have higher levels of anxiety than people without disabilities. And people that aren't worried at all about their financial situation and actually think that it's going to get better over the next 12 months are much less anxious than everybody else. So we know there are important group-wise differences in the life satisfaction, anxiety, happiness, and worthwhile that we would expect to see in the population that are exacerbated in this current situation. Next slide, please. So that's general well-being and the trends that we're seeing in the UK population. But what does this have to do with work? Next slide, please. Well, we know that having a job is really important for well-being. So this is data that's from Western Europe, included in the World Happiness Report, that looks at the difference between people's life satisfaction, happiness, and anxiety, comparing people that are in work with other work statuses. So what we find in the bottom line of this table below is a statistically significant relationship where people that are unemployed are less satisfied with life, less happy, and more anxious. So we know that having a job matters systematically for your well-being. But we also can see, for example, in the line that captures people that are employed part-time but would like to work more hours, that it's that nature of the job that also matters, because people that would like more hours are also less satisfied, more unhappy and more anxious. So we've got to think not just about having a job in and of itself, but what does that job look like? Next slide, please. Income is important. The amount you get paid for your job does matter to people's well-being. This chart maps life satisfaction against salaries and defines people by the sector in which they work. So there's a general upward slope to this chart, whereby professions that earn more money tend to exhibit higher life satisfaction. But actually there's a lot of variability over and above that. So the clergy and construction workers, for example, earn the same amount of money, but there's a very big difference in how much life satisfaction that they're reporting. The clergy are far happier. In fact, they're even happier than the highest paid other sectors in CEOs and senior officials. So there's other things going on in the way that jobs work and the design of that work and all those aspects of job quality that help to determine people's life satisfaction. Next slide, please. This data from the Health and Safety Executive is capturing the differences in anxiety. So the last slide was about people's reported life satisfaction. This one's really about anxiety by different professions, and finds that people working in public administration, education and health tend to be more anxious than other professions. And a lot of that is attributed to workload. What's important to mention, though, is there can often be a trade-off between these different dimensions of well-being. So next slide, please. This data is from the Civil Service People Survey, which asks again these 4 well-being questions and reports the results by different government department. So what you see here is that for people working in the Department for International Development, they tend to report a higher than average sense that their life is worthwhile, but a lower than average sense of happiness. So they're more positive on the sense of worthwhile and sense of purpose, but less happy and actually more anxious. So there can be this trade-off between a job that feels very purposeful and one that you feel very stressed about. In contrast to the Department for International Development employees, we've got the Government Actuaries Department, arguably a less purposeful government department, who feel a lower sense that life is worthwhile, but as a result are also less anxious with it. So it's important to look at all these different dimensions of well-being and how they might play off against each other as well. Next slide, please. So what is the reaction to COVID? Well, we know that people that reported that they think that coronavirus will cause direct impacts on their work are less satisfied, less worthwhile, less happy and more anxious. So where you think that COVID-19 will have a direct impact on your job, you're reporting a lower sense of well-being, which is quite intuitive to understand. Next slide, please. So what is it that might be causing this lower level of well-being? Well, we think it's useful to break it down into 5 different dimensions that we know affect people's well-being. Ask people systematically across all these different dimensions how things are going, and recognize that there are underlying issues in these different dimensions that people will be experiencing, as well as the impact directly related to COVID. So let's go through them one by one very quickly. So on health, as Mel mentioned, people will have underlying health conditions, mental health issues, physical health issues, which will affect their sense of well-being, their ability to do their job well. But the added impact of going to a workplace where you feel there's direct health risks from contracting the disease, for example, if you're not able to work in an environment that's got sufficient social distancing measures, or if you're sat at home and it's an inadequate environment for your own physical workspace, those underlying health issues will be compounded by the impacts that are due to the changes from COVID. Security, similarly, you'll have people with underlying financial security issues, underlying debt issues, and so on, but then there'll be this compounding effect from particular sectors and individuals and jobs that are affected more directly from COVID, where jobs are less secure due to the changes that are happening in the sector that they're working in, or due to the uncertainties around the extension of furloughing, or whether their contract is secure or not in the first place. In terms of your environment, again, as Mel said, it's not just about your kind of physical setup, but it's whether or not you've got homeschooling in the background, as well as trying to organise your work. So different people will have very different experiences of work environments before coronavirus, and the changes as a result will just compound them. Relationships, I think it's really interesting that this has come up a lot in the chat box as well. We know that relationships are incredibly important to people, not just for their own well-being, that being partnered is a very helpful thing to have, having someone to rely on, and social connections, being a part of your community shows up as a really important driver of well-being, as loneliness shows up as a really important driver of low well-being. But also relationships in the workplace is one of the key drivers of job satisfaction. So the relationship with your managers and with your colleagues, feeling a sense of belonging and teamwork is really crucial. And these will all necessarily have been affected by the social distancing measures, which change the nature of our relationships with our colleagues and with our line managers. And so it's really important to put in place measures that can keep those connections strong, keep those communication lines open. And purpose. What we've seen in the data around jobs is a real dichotomy of people that are either furloughed and really lacking that sense of purpose and structure and those relationships and everything else a good job gives you, and people that are at risk of unemployment or have already been made redundant as a result of it. And then on the other hand, some people experiencing real work pressures with increased workload, increased care responsibilities, with the support network they would otherwise have not being there to fall back on. So we're seeing these kind of two extremes of people having a sense of either work overload on the one hand, or lack of purpose and direction on the other hand, that it's really important to recognise. So some of the things that can be done to support people in those different situations include, for example, the furloughed workers, looking at ways to retain learning and development opportunities whilst not formally engaged in the workplace, or for people that are struggling with the workload, looking also at work-life balance issues and what can be done to support those individuals. Next slide, please. So we've been publishing a series of email updates over the last 6 weeks, and we'll continue for the next 6 weeks, focusing on some of these core issues that we know underpin people's well-being and what can be done about it, whether it's about investing in relationships or whether it's about investing in learning and development opportunities. But what's really critical to note is that every person experiences well-being differently, and the different things matter to different people. And that's why, going back to those original ONS questions, that it's really important to ask people directly how they're doing, and why we also encourage people to ask employees systematically across those 5 different dimensions what they're experiencing, and therefore assist employers to put in place mitigating strategies. Oh, the final thing to say is please do sign up to receive these email updates if you're interested in finding out more. And then back to Ed, I think.
Yes, thank you, Deborah. Really great presentation there. There's a lot of food for thought, I think. Just a reminder to all that we will be sharing these slides at the end of the presentation. So if you do want to take another look at some of those graphs, etc., they will be available on the Coronavirus Hub website. So I'd like to bring you both now into a Q&A section, and just to share some questions that we've received through from people on the call. So those of you who are listening, please do ask any questions that you might have to Deborah and Mel. But I'll start with a question really to you, Mel, about some of the responses that we've seen from employers over the last few weeks as a result of things like flexible working and moving people to work from home. So the likes of Facebook and Google have come out and said that they're going to be quite long term, and they expect them to continue well into 2021. From a well-being perspective and a measurement of well-being perspective of the level of employees, is anything that we need to consider from a measurement perspective that can help us to see whether or not it's sustainable from a wellbeing perspective, or if it's something that may actually could cause risk for individuals if they are working from home for a prolonged period?
Yeah, so that's a really interesting question. You're right, we've seen quite a lot of high profile examples of organisations saying that home working will be their new way of working, at least for the foreseeable future, if not forever. It's an interesting one, because I think, as we've seen in the comments, there's trade-offs to be made there in terms of there's potential benefits in terms of more flexibility in commute, but there was real issues around things like isolation and being around colleagues. And something we haven't spoken about already is that for some people, working at home isn't ideal for various reasons, whether that's because they don't have a good working setup at home, or they might have a really difficult environment at home for various reasons. So in terms of measurements, it's really important that in both returning to work, or as the case may be, not returning to work, that employers really consult with employees on this. So if they do want to come back into the office, why is that? Are there things that people might need support with? And also understanding how happy people will be to do this before making decisions. Obviously, it's a sort of longer term view, but consulting, understanding what proportion of your workforce might want to work in this way, and if not, how you can support people that don't want to, will be really important. And of course, line managers are really key there to understand what those underlying issues are.
Yeah, it's highly contextual, isn't it? Bring you in, Deborah. Have you got any reflections on this news of big employers saying this is going to be a long-term solution to this issue?
Yeah, I mean, I agree with everything Mel said. The only thing that I'll add is that there's some big inequalities that we see in people that are able to access good quality jobs, and they tend to be concentrated in particular parts of the country and more accessible to people, for example, that don't have disabilities. So one opportunity that does come from more remote working is the ability to reduce that inequality and make good quality jobs more accessible for more people. So I think there's definitely all the stuff Mel mentioned about thinking about how an individual feels about flexible working and working remotely. But there's also this bigger question about how we can create a labour market that actually has more good quality jobs that are more accessible for more people. And then what kind of infrastructure we need to make sure that if more people are working remotely, what kind of hot desking offices do we need in different towns around the country, and what different social support networks do people need so that they're not feeling isolated. So thinking more systematically about what that would do for communities and for places.
That's a really useful point, isn't it? And I like your perspective on not being driven by the averages, but looking to the outliers to make sure that we're inclusive across the piece. So making sure we are looking at the needs of individuals in their specific, unique contexts. So like you say, there's a really important challenge, I think, for organizations. It's great that some organizations have the technology in place to support individuals to want to, or to be able to work like this long term. But the question of, is it what they want? And when is it safe to perhaps return to a flexible working arrangement, which is created between an individual and an organization? I think that's one of the key questions for us. I'd like to stay with you, Deborah. Just a question there about a lot of the kind of tension for an employer or a person working in HR who's interested in this may look to things such as benchmarks to see how their organization is comparing, particularly around measures of well-being. And clearly in your presentation, you talk a lot about the importance of looking deep into some of these measures, and the 5 areas of subjective measurement of well-being that you suggested to measure were really quite interesting and quite comprehensive. What are your views on the kind of benchmarks that might be available, and do you have any advice to professionals who are looking to maybe benchmark their own practices?
Well, the best questions we would always recommend are these ONS 4 questions, because the benchmarking data is there and it's good, and it's asked at the national level with a really big sample, so you can break it down by different sectors, as you saw in that graph, by different professions, and over time and so on. Because I think you've got to put these scores in a context, because otherwise somebody reporting a 6.3 on a scale of 0 to 10 is meaningless unless you have that benchmarking data to see how people have been doing in the past and how people are doing in other spheres and in other organizations. So it's really important to have that benchmarking data to put it in context, but I think that it's also it takes me to another point about thinking about change over time within an organisation. And if you want to put in place a wellbeing policy and wellbeing interventions and really focus on investing in people's well-being, then it's really important to do a good evaluation and ask people before and during and after how things have been changing, so that you know whether you're doing something that's of value or not. So key for us is that we should be investing in people's well-being in an evidence-informed way. So we really encourage people to collect that evidence, to really take evaluation seriously and include those well-being questions in their evaluations of different interventions to demonstrate how much well-being you get for your buck, if you like.
It's a great point. It's this idea of trying to measure over time how our HR practices are shaping the quality of work for individuals. And I think we should always remember that evaluation is a key part of our practice. So really good reflection. Thank you, Deborah. Question for you, Mel, from the Q&A box. So someone's asking the question of whether or not the questions that we ask in the COVID-19 survey might be made available. So in particular, if there are any organizations wanting to pulse check how employees are feeling and to then benchmark against this index that we're creating, what are your thoughts on that?
Yeah, so we can think about making them available in terms of the pulse questions. I think that's a really smart way of thinking about it. I think just to add to Deborah's point about evaluation, I think often we do survey our employees quite a bit. Other organisations might already have existing measures. So whether it's in an engagement survey or a culture survey, it's also worth thinking about whether those can be used again in these circumstances, because obviously it's useful to understand what wellbeing was before as well as now. But certainly happy to share some of the questions.
Great, thank you. So remember, please do ask any questions that you might have. We've got about 5, 6, 7 minutes left, so please do ask any questions if you've got any into the Q&A box and we can pick those up. Got another question in the meantime for you, Deborah. Obviously, you talked a lot about the disruption having a significant immediate impact on levels of anxiety, but then that anxiety normalizing over time. So there's a question there about how HR and line managers can support individuals to be able to withstand these kind of shocks. And I wonder if you've got much experience of looking into the concept of resilience, both at an individual level but at an organizational level. And in particular, in this context of understanding well-being, is resilience something that could be an approach to thinking about in enabling we do protect against shocks of this type?
Yeah, so I mean, I think there's anyway good literature on change management, and recognizing that change management is a process that's really necessary to support organizations where people feel a great sense of uncertainty and anxiety as a result of change. So it kind of all fits in with that literature there. And in terms of building resilience up, and one of the things that we found in the data that was quite clear when looking at organizations in response to the 2008 financial crisis was that organizations where employees expressed a stronger sense of belonging and engagement with the organization weathered the crisis much better. So resilience in that sense was a real sense of teamwork and camaraderie, and of the organization pulling together and individuals within that organization really feeling that quite directly. So I think that's kind of a way of thinking about the mutual benefit of organizational resilience and individual resilience, and that it really, like, relationships are a really important part of that, and the relationships that you build between your colleagues and your management and staff being a really critical factor there as well.
Yeah, I find this is a really interesting space as well for those on the call who might be working in organizational development or design roles. This concept of building resilience for the system, the organization, to be able to withstand this kind of stress, but then also at the individual level, how you can support and prepare line managers to enable their teams to be able to work effectively through such things such as a pandemic of this size, I think is a really interesting space for OD practitioners to be in. So if you've got any questions or anything on that, then obviously we've still got a few minutes left, so you can ask any questions there. I would also like to just ask a question to you both, really, about some of the tensions that we're seeing in the kind of conversations around well-being. So obviously in the immediate term, we're expecting there to be a significant recession. and that actually there could be a real dip in productivity for the UK. And obviously you spoke there a little bit, Deborah, about the response to the previous financial crash in 2008. Are there any kind of reflections perhaps that we should be looking to from how organizations responded to the financial crisis then in terms of recession that we should be considering now as we prepare for what looks like quite a significant recession? Significantly, obviously for well-being in particular, what are some of the kind of well-being concepts we should be thinking about going into this clear recession that looks to be on the horizon? Deborah, do you want to go first? Any thoughts?
Yeah, I mean, I think the impact of COVID is so multi-dimensional because it's health and because it's economic and because it's social, because people are separated, friends and family, that it's really important that we look across that whole piece and look as much at loneliness as we look at the financial implications to businesses, for example. So in terms of thinking about the recovery and the response to it, it's equally important that we look across that whole piece. We know that at the fundamental level, to support people's well-being, then basic needs must be met. So before we start looking at these kind of nicer factors, if you like, of job autonomy or, you know, feeling engaged, people need to have enough income, need to have enough to eat, and need to have that kind of reassurance that they're going to go into hospital and, you know, have a bed to be treated. So there are some really fundamental kind of reassurances that people will need to have at the kind of national and community level. So that's the kind of the first level. And then for employers in particular, looking at different sectors, I mean, one thing that could be an option that employers wish to explore is that you can reduce, the data shows you can reduce people's number of hours dramatically down to even as few as 8 hours, and people still get that same sense of worthwhile and purpose from their work that they wouldn't otherwise get if they were unemployed. So one thing could be sharing, if you like, the remaining work that's available. So where productivity is lower, and, you know, output is less, you could think about reducing everyone's hours across the piece to enable more people to remain employed, if that works, and the pay is sufficient to facilitate that for a given employer. So that's one way that you can respond to the foreboding sense of unemployment. But of course, all those other things, like the relationships, like making sure that people feel like they're well connected and they're not isolated, there are things that you can do to stay connected, you know, and to keep people involved and engaged in an organization. So as I say, just looking across that piece and going through all those dimensions I mentioned, to think about what can be invested in that, even if it's directly affected, can be mitigated.
That's a great point, and I think that's something, a nice point to end on, is this idea that the role of the profession in doing that. Everything you spoke about there are really in the hands of professionals working in HR, OD and L&D to work through their practice. So withstanding whatever comes over the horizon, but also protecting individual well-being is central to what we do as a profession. So really nice point to end on in terms of reflection. So thank you very much for all of your participation today. I hope you found it a really interesting discussion. It just remains for me to say a couple of final points. So firstly, if you do want to reflect on the conversations today, do check out the slides. They'll be available on the hub page, on the CIPD hub page on the website. We have all sorts of different member benefits for those of you who are members available to you. Number one of which at the moment really is the COVID-19 Resource Hub. It's full of lots of really interesting and important information, and also exciting research that's coming out from us at the CIPD and our academic networks, all around how to support you in your practice when it comes to COVID-19 and your response, not just today, but also into the long term. Because as we've been talking about there, this is going to be a challenge for us over the short, medium and longer term. Please also take time to look at the current webinar series that's coming up. We're going to be publishing new webinars on a frequent basis, doing 2 a week at the moment, and there's going to be a lot more information available to you on different areas of practice. Like I said, at the end of this week, we're talking about diversity and inclusion through COVID-19. So that touched very much on the conversation today, but please do sign up for that webinar if you're interested in learning more about how to maintain inclusion through the crisis. And then finally, do also check out the webinar series and also wellbeing content that I've spoken about. So our wellbeing helpline is available 24/7 should you be interested. It's developed by our award-winning provider, Health Assured, and it's a really great resource that's completely accessible now to CIPD members. So do go and take a look. Thank you very much for your time today and have a wonderful afternoon. Thank you very much.